Sexuality and Aging. Sexuality is a basic human need and it does not change as we age. Many older adults will continue to have sexually satisfying lives well into old age, and sexual needs don't disappear as we age. Sexuality will include the psychological, social, and moral aspects of our lives comprising sexual health. Sexuality provides opportunities for the older adult to express and receive affection, connection, and emotional bonding. Factors that affect sexuality of the older adult includes a slowing of the sexual response time. In women, normal changes include decreased levels of progesterone and estrogen, discomfort during intercourse related to postmenopausal changes, and other alterations that can be caused by illness, stress, or medications. In men, normal changes include orgasm taking longer to achieve, and it has a shorter duration than at a younger age. Ejaculation will be less forceful, and there will be a smaller volume of seminal fluid released. Loss of erection will occur quickly after orgasm, and time between orgasms increases. Orgasm may not occur with every episode of sexual intercourse in the older man, and the most common altered function is erectile dysfunction. Illness has an impact, and it is a common cause of changes in sexual well-being. It includes joint pain and cardiac problems that are more a result of fear than from actual danger. Weakness or paralysis as a result of a stroke. Loss of body parts, such as a breast or uterus, can make a woman feel less desirable. Chronic depression decreases interest, and incontinence can cause people to avoid sexual contact because of embarrassment. Excessive use of alcohol can delay orgasm in women and causes a loss of ability to achieve or maintain an erection in men. Medications and drugs can also lead to sexual problems such as antihypertensives, central nervous system medications, estrogens, cholesterol-lowering drugs, antihistamines, decongestants, anti-inflammatories, and street drugs. Changes to medications or dosages may help resolve these issues. And loss of a partner. One of the most common causes of decreased sexual activity in older adults is the loss of a partner, and it's a particular problem for women over the age of 70 because single women over 70 outnumber single men 4 to 1. Marriage or remarriage among older adults will garner many different responses, particularly from the families of older adults. Some families are accepting while others are not. They're not always an option though because of contingencies and pensions and insurance benefits, etc. Some young people may not be comfortable with the thought of sexual activity among seniors. Healthcare professionals need to address issues of sexuality in private with open-ended questions. Studies estimate that about 2.4 million Americans over age 65 are LGBTQ. These populations face increased difficulties because of age and sexual orientation. Population tends to be underserved as healthcare and social services are not always well equipped to deal with these particular issues. And they are just unable to provide adequate support. And people may be uncomfortable disclosing sexual orientation because of fear of discrimination. Older adults are not considered when sexually transmitted diseases are discussed, yet half of the HIV AIDS cases occur in people that are older than 50 years. All sexually active individuals, no matter what their age, should use safe sexual practices. The risk for sexually transmitted disease does not disappear with age, particularly since many older adults came of age before safer sex practices were the norm. Older adults have a right to manage their sex lives without interference, and they should be free to express affection and engage in sexual activity whenever they choose. Institutionalization can interfere with the older adult, their ability to maintain their usual patterns, and obtaining adequate privacy may be difficult. Touching, hand-holding, and cuddling are encouraged. A closed door must be respected when privacy for intimacy is desired. Judgment is important if either individual suffers from cognitive impairment, and it's important to protect vulnerable older adults from any undesired physical contact. But mutually agreeable physical contact should remain a right of older adults. So questions for assessment of altered sexual function include, is the person sexually active? Do they complain of any difficulty or discomfort during sexual intercourse? Do they have any discharge or drainage from the genitals? Does the person have any diseases or disabilities that interfere with sexual activity? Are there any emotional issues that interfere with sexual interest or activity? Does the person take any medications that might interfere with sexual activity? What level of sexual activity does the person desire? Does the person have any real or perceived barriers to sexual activity? Does the person have adequate privacy for sexual activity? Risk factors, once again, are going to include loss of a partner or problems with physical mobility, an institutional setting, and physical illness or reaction to therapeutic medications. Goals for these people will be for them to verbalize their feelings about their sexual identity and discuss concerns regarding sexuality, while interventions include encouraging verbalization of their concerns and providing privacy, and protecting the sexual dignity of confused older adults. So, true or false? Masturbation should be discouraged in older adults. This is false.